Prime Minister says that essential workers on the front lines of the pandemic will be getting a wage boost. It's a $4 billion agreement with provinces and territories that will see the feds kick in 3/4 of that. And the provincial and territorial governments, will decide who qualifies and how much of a raise they will receive. So are there any conditions attached to the deal? And should the top-up be made permanent once the pandemic is over? Jean-Yves Duclos is the president of the Treasury Board and vice chair of the Federal Cabinet Committee on COVID-19. He joins us from the House of Commons foyer. Hi, Minister Duclos. Good to see you again. Minister, are there any strings attached to this money for essential workers in provinces? The Prime Minister had originally said it would be for workers making less than $2,500 a month. Is that not the case anymore?
Well, before I turn to that very important question, let me first start by saying that this is a very important agreement for two reasons. First, it's going to assist our workers, essential services workers, those that feed us, those that keep us healthy, those that protect us. And second, this is a very fast agreement. In a matter of just a few weeks, we were able to come to that agreement that is going to give all those essential workers more help to look after ourselves. Now, the second thing is that no, there is no string attached. Provinces and territories are masters of that program. They will decide what their needs are and what their priorities will be.
So that $2,500 threshold has been eliminated?
That is correct.
And what about any extra parameters on the money? I'll tell you why I'm asking. For people, for example, who work in privately run long-term care homes, they of course deserve to be paid more. I understand that. But shouldn't the private companies that run those homes be doing that? Why is the government subsidizing private companies?
Well, we understand that there is a big variety of circumstances and needs across Canada. We have a big federation. Provinces and territories know their circumstances best. So that's why there is a complete level of flexibility for provinces to establish their needs and their priorities. We understand that in some cases it will be delivered in different ways, again, depending on what works best in the circumstances of individual provinces and territories.
But how are you ensuring, and in no way am I taking away from the fact that these workers deserve extra money, 100%. But how are you ensuring, this is $3 billion, right? That money isn't going to private homes that make profits, that are taking in profits rather than paying their staff more money?
Well, first we have full confidence in the ability of provinces and territories to do exactly what you've just said, which is to pay essential services workers. These are the workers that need and deserve our help in the very emergency circumstances in which we are living. So we have full confidence that provinces and territories will be able to do that and will be there to support them.
But you're not requiring any assurances from provinces that, for example, they check to make sure the essential workers in a privately run home are not, there's no check on basically what that private company is doing. You're not requiring any assurances, correct?
Well, it's like in the case of our emergency wage subsidies. Now, the parameters depend on exactly the circumstances of the businesses. However, the key objective is always the same. In this case, it's to help essential services workers to keep feeding us, to keep us healthy, to keep protecting us. So this is absolutely essential. And we have, as I said, we have full confidence that our relationship with provinces and territories will lead exactly to that precise outcome.
But it's not exactly like the wage subsidy program, because that program has certain restrictions around it. In this case, you're just giving the $3 billion. And I understand the province's jurisdiction to a degree, but we're seeing, again, I'll explain why I'm asking, we're seeing all of these stories right now of privately run homes, and publicly, to be fair, but privately run homes where 80% of the deaths in this country are occurring in long-term care homes. And there are questions from the people who live in these homes and their relatives about the way in which these private companies are running the homes. And in fact, now, you're going to be helping out workers, which is good, but it sort of, does it not sort of take the responsibility away from those companies? And what will you do to address that going forward?
Well, exactly that. To help workers, as you've said, is exactly the objective. We have, as we said, complete confidence in the ability of provinces and territories to do that. Some of them, in fact, have already put into place programs that have this particular exact objective, which is to deliver help to the workers themselves. So there are all sorts of mechanisms, and as I said briefly, we've seen this at the federal level, all sorts of mechanisms to ensure that the actual help is going to the workers.
What happens once the pandemic is over? Are these workers expected to go back to earning minimum wage?
Well, this is an emergency circumstance, and that's why I was glad to say at the very outset that this is done in a very emergency setting as well. Very quick agreement with all provinces and territories on something that has never been done. We've never seen in the history of Canada federal and provincial governments come together and support essential services workers. Now, the emergency circumstance that we're living through now says exactly why we should do that. I think we have learned over the last few weeks the importance of these essential services workers, and that's why we have come to this agreement. Now, I think we're also learning important lessons for the future. We're learning about the importance of supporting long-term care center workers, the food workers, those workers that work very hard with sometimes very modest wages. So it opens up also a conversation for the post-crisis situation.
With respect, though, having a conversation doesn't necessarily address directly the substance of my question. Do you expect, after this initial funding runs out, for workers in these homes to go back to earning minimum wage?
Well, of course, this is depending very much on the jurisdiction and responsibility of provinces and territories. As the Prime Minister has said earlier, we are not there to tell provinces and territories what to do, especially when it comes to healthcare, education, and other areas of purely provincial jurisdiction. Now, that doesn't mean that, as we're announcing today, that the federal government cannot help provinces and territories deliver the type of support that these workers need in order to protect us citizens. So that's, I think, a good sign, and when we work together, we can arrive quickly at some important outcomes. And as I've said, I think that's going to pave the way for other things in the future.
Wouldn't this have been a perfect opportunity, though, to attach some sort of condition to the money? I mean, you gave them $3 billion today, and there are no expectations on provinces, on homes, on the people that run them, to keep paying these workers who are essential, not just now, but even after, more than minimum wage?
Well, again, the key word is emergency. We needed to do that quickly because now is the emergency. We need those workers, and we need to look after them as they look after us. That's why we have done that very quickly. As I said also, that leads to other discussions that we'll be having after this crisis is over.
Okay, Minister, before I let you go, I do want to ask you about another service that affects a number of our country's most vulnerable people. Greyhound has stopped running because it depends on fares wholly. It's seen a 95% reduction in business. They're asking your government for $25 million, along with sort of a coalition of other small carriers, to keep about 50% of their schedule for the next 6 months so that their riders, which are predominantly women and people with lower incomes, can continue to have that option to either get to their job or to just travel between cities. Is your government going to provide them with that money?
Well, we, of course, as you said very clearly and very well, this is something absolutely important, especially to modest wage workers. Again, we need them, we need their work. So it's another example of something that we'll have to do in the medium term. As we move through the crisis, helping each other, collaborating across levels of government, we're also learning lessons that I think will inform many discussions and conversations and a lot of actions in the future.
What's the medium term, Minister? And I ask because they've suspended all their services right now.
Well, the medium term in the current crisis is quite short. So we are not only hearing those concerns, but very mindful of their impact in our society and for workers. And that's why we look forward to do quickly the type of engagement that we've successfully done with provinces and territories on today's announcement. When
will you announce a decision, or when will you make a decision on this? And I'm asking because you're also considering bailouts for airlines, bigger companies. Greyhound is asking for $25 million along with these other carriers. When will you make a decision?
Well, I would like to tell you when now. Unfortunately, I am unable to do so. However, what I can tell you is that those sorts of circumstances are not only very important, but we hear them really well, very, very much. And we are also aware that, as in many other aspects of the emergency crisis, we need to work with many other partners, including provinces and territories.
Okay, I'll leave it there. Thanks very much, Minister. Appreciate your time this evening.
Thank you.
part of the whole conversation around long-term care involves an announcement from the Prime Minister earlier today on a wage top-up for essential workers, many of whom, of course, work in those homes. Here's how he spoke about how it will be decided on how much money each worker gets and who will qualify as essential. Here's the Prime Minister.
Premiers from across the country all agree that we need to support our essential workers. It will be up to each province and territory to determine who exactly qualifies for this wage increase, but the bottom line is this. If you're risking your health to keep this country moving and you're making minimum wage, you deserve a raise.
So what are the challenges of deciding who gets more and how much more? The Power Panel is finally here to weigh in. Host of the Hurley Burley podcast and partner in the Gandalf Group, David Hurley joins us. Rachel Curran, former Director of Policy to Stephen Harper and Senior Associate with Harper & Associates, is with us as well. And Chief of Government Relations for University of Toronto, former Saskatchewan Finance Minister Andrew Thompson is with us to make it a three-peat. Hey guys, nice to see you.
Hey, Ashley.
Andrew, why don't I start with you? This is a significant announcement from the federal government, $3 billion. It begs the question, what happens after the pandemic, though? I think a lot of people in this country have realized just how essential the people who work, for example, in long-term care homes are. But it seems, this is obviously to address the situation right now, but there are still questions about what happens after.
Well, it is good to see they've finally acted on this. This is something the NDP was calling for back at the start of April, when we were really going through the most difficult times of adjusting to this lockdown and the fact that some people were being forced to go to work or required to go to work, while others of us had the luxury of working from our living rooms. It is good to see. I think it is going to raise the question, and I expect you'll hear this many times repeated. It's nice that the Prime Minister says today that those who are putting themselves at risk matter now for the next 16 weeks that this kicks in for. I wonder what happens as that kicks out. And I think that will be a real question for provinces to have to figure out as to why not just raise the minimum wages for these most marginal workers and be able to make sure that they are paid an appropriate amount to undertake the tasks that we expect of them.
What do you think about that, Rachel?
Yeah, I mean, Andrew's right. There is no way. I don't think there's any way that this is ever going to be rolled back. What are you going to say to these minimum wage workers, in the fall when they're still taking a risk, if the virus has returned, hey, thanks for your service, but we're going to reduce your wages now? Like it's just, I think this is essentially a permanent increase to the minimum wage. And it's a bit unprecedented. There is the work sharing program, of course, but to have the government allocating, I think in total, $4 billion to increase the wages of workers in Canada, it's an enormous sum. Look, politically, I think this works for the Liberals. This is a really good effort to absorb what's left of the NDP vote. And it is warranted in the circumstances for long-term care home workers, for instance. I just don't think this is a measure that can be easily unwound. And what does that mean for the deficit going forward? What does that mean for all of these other emergency measures, tremendously expensive emergency measures going forward? Because we can't sustain deficits in the order of, $250, $300 billion per year.
What does it mean, David, do you think, going forward?
Well, I mean, I would share, I guess, some of the issues that my colleagues have expressed and put it this way, which is, I'm sure this is welcome and this is a positive gesture toward these people. But why are these jobs paid so poorly in the first place? And why will they be paid poorly again after this pandemic is over? I mean, in BC, they're saying, well, at least for the time being, these will still have to be one worker per home, like one home per worker. They won't be able to go to multiple homes. Well, that's because it should be a full-time job. I mean, part of what has to happen here in the post-pandemic world is a realization that all of our priorities have been out of whack. And we've been underpaying some people very dramatically and undervaluing them. As Mark Carney says, if it doesn't have a price anymore, it doesn't have any value. And on the other hand, probably people are getting, in fact, certainly people are getting too wealthy in our society, and there's going to have to be a rebalance. And one of the things that needs to happen is understanding the importance of care in our society and how important the caregivers are and how underappreciated and undervalued they are, whether they're outside the home or inside the home.
It's interesting, Andrew, because to that point, we have interviewed a number of people who work in those homes over the past few months, and I wish I had been interviewing them before, because you know, if you've been through it with a family member, you know how tough it is. But when you speak to them, even now, a few days ago we talked to someone in one of the worst hit homes in Quebec, and I was asking her, she said things are a bit better, but I was asking her if she had hope that, you know, there is this realization now that things in the system are not working, and whether she thinks it will be rectified. And she really did not have a lot of optimism, and that kind of jumped out at me.
Well, it is part of a privatization agenda that's been in place for a long time, and you know, there are benefits to having long-term care as community-based care. I mean, there is a model that works for that, and I understand why that's there. But it can't be disconnected completely from the healthcare system, and that's kind of what we've done. I do agree with David that, you know, there's going to have to be a fundamental rethinking here of how some of these pieces join up, and it may mean that we need to take the profit back out of the system, and that we need to you know, bring some of these pieces back into the mainstream healthcare system. That's not going to be cheap, though, and I think Rachel's point is also an important one, that, you know, it's going to cause us to have to rethink how those spending priorities work, because if that's now the priority, then we're going to make sure that we do, in fact, have proper long-term care, and I would argue on the other end that we should have proper early childhood options. You know, that there's a cost to that. And traditionally, when that's been brought forward in elections, as it was in 2015, there was a big sigh and a shrug from most of the parties about it, because it wasn't seen to be vote determining, and it wasn't seen to be something that was really worth putting the money into. Maybe our thinking's changed, but I'm not entirely convinced that once this all goes away, we won't just revert to our old ways.
I just have a minute before I have to take a quick dip down into black and come back, Rachel. But I do. I interviewed the former health minister in Quebec a few weeks ago as well, Gaetan Barrette, and to both of your points, he said if you wanted to match the care in long-term care homes to what you get in a hospital, it's an extra $5 billion a year just in Quebec.
Yeah, it's massive. And keep in mind, like, this may be justified. In fact, it is justified for long-term care home workers. Of course it is. But this measure isn't just applied to long-term care home workers. It's across the board, anyone who's risking their health. So that's really any frontline worker. It's retail workers, it's grocery store workers, anyone making minimum wage. So that increases the cost enormously. Right. And again, I don't think there's a clear end point there. This isn't going to end in 4 months. We know the virus, or I think we know the virus is still going to be with us for a while. So assuming this is going to be a long-term measure, that no government politically is going to take the hit of rolling it back, you know, how do we pay for it? And what do we do with all of those other minimum wage workers as well? Yeah, and to that point, David, I mean, like Rachel said, it depends on the province you're in. The province will be able to define that. But by and large right now, essential workers do include, I mean, all of those who are risking their health essentially to deliver the services we need. So someone in a grocery store, maybe a pharmacy, and in a long-term care home. This package comes alongside a lot of other aid packages that will be almost, you know, up for renewal. If I could use, I don't mean that crassly, but they have a finite amount of time which the government allotted for them. But the situation we're in right now is certainly not over in a few months.
No, and I would separate long-term care out from some of the other employment situations. If you are jeopardizing your health to do this, I understand why you would perhaps get a top-up. These top-ups are also, by the way, to encourage people to continue to do these jobs and to jeopardize their health, so they're not entirely altruistic. But I understand that. But long-term care is a different situation. Long-term care, this was a festering mess that everybody knew about and just didn't really care about until this happened. And I suspect that this is going to be a really powerfully motivating political issue, because you have an entire generation of people without a pension, without any savings, headed toward retirement, and they're going to look at what was the situation in these long-term care homes, and I bet it does become a vote-determining issue, whether or not we upgrade the value and upgrade the level of care in these homes that most of us are going to end up in.
Okay, I got to leave it there. Thanks, guys. Great pleasure to have you with us. Thanks for your patience this evening. Really appreciate it. Thanks to Andrew Thompson, Rachel Curran, and David Hurley. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.